Well, now, a pregnant American woman who travelled to Malta on holiday with her partner has found herself in a devastating situation after developing complications. Andrea, who's 16 weeks pregnant, has been experiencing blood loss, and doctors have said her pregnancy is no longer viable. But due to Malta's strict anti-abortion laws, Andrea has been denied a termination. The couple are now hoping to fly to the UK for the procedure. Well, we're now joined by Andrea Prudenti's partner, Jay Weeldreyer. Jay, I mean, this sounds like a devastating predicament for you both. First of all, commiserations on the loss of your child, but how worrying for you as well for the health of your partner.
Yeah, it's been a pretty terrifying experience.
And were you surprised, I mean, when you were in Malta and realised that you tragically needed to seek out a termination, that it's not available there?
100% surprised. We expected that Malta, as part of the EU, had medical system that would be in conformance with most of the EU and the United States. The thought that we couldn't get proper medical care never crossed our mind.
And what sort of things did medical staff say to you, that it's strictly prohibited, even on grounds of medical necessity?
Yeah, they weren't that direct. I think that partially the laws are so strict that I think that the medical professionals are even limited in how much they can communicate around abortion. So the communication came through in more subtle terms, and it took us a couple of days of research and learning to figure out why they weren't saying what they weren't saying.
And what is... expand upon that. What is it that that you've gleaned from all of this in terms of, is it a cultural Roman Catholic perhaps practice in Malta that is part of their legal system?
Yeah, I think that, my suspicion is that that's part of it. I think that it strikes me as a really conservative culture and very much Catholic. I don't really know enough about cultures in the Mediterranean. Perhaps they've got something in common with, other old conservative cultures, maybe like the Greeks or the Italians. I'm speculating here, I don't know. But the sense that I have is that the traditional belief here is that women and mothers are supposed to sacrifice for their children. These are messages that I've heard, that it's normal for women to sacrifice for their children. And they have a deep anchoring that heartbeat is equal to life. And so anything that's going to interfere with the heartbeat is interfering with and terminating a life. And in this case, it becomes a real challenge because you're dealing with what is essentially a miscarriage or a birth that's gone 85% or 90% of the way. And there's no possible way that the child can survive. And there's also no possible way that the pregnancy can continue. And the only possibility is that by allowing the pregnancy to not terminate, you're exposing the mother to ongoing risk of infection that could be fatal. And there's nothing that the medical industry could do or that any professional could do to stop it if it sets.
So what is the plan now for you and Andrea? I understand you're going to try and come to the UK to get that treatment.
That was the original plan. The UK, it turns out, flying, unfortunately, given her current condition, the risk of hemorrhage and bleeding to death is significant. So every minute that you're not in a hospital is extraordinarily dangerous. The UK is a preferred destination because the healthcare system there is wonderful. Our insurance company has a presence in London. Apparently, the chief medical officer has associates in hospitals there. So that was the plan. But we're having to be redirected to a different destination that has a much shorter flight.
Do you mind me asking where you are heading off to?
Yeah, I actually got a call from insurance saying that we can't disclose it because the destination is already saying they're really concerned about protests and about pro-life activists interfering with the arrival at the airport and potentially interfering at the hospital.
Wow, gosh, I mean, that is shocking. My thoughts are with you. It sounds like a really terrifying and traumatic situation at the same time. Thank you so much for coming on the programme today and talking about it.
Thank you.